The fund flow analysis was focused on how we can mobilize funding for neglected tropical diseases in Cross River State. Since last year, we've been engaging stakeholders to find how funds can be mobilized for neglected tropical disease from the state.
During this workshop, we brought all the leadership from several ministries, including Ministry of Health, the Ministry for International Development and Cooperation, and several others.
In day one, we have had the opportunity to have presentation from the different leadership within the state, both from the permanent secretary, both health and also MIDC. We had the opportunity. We had presentation from Dr. Iola just to showing us the outcome of the presentation and also just to collect feedback with regard to that presentation. During day one, we also had presentation from the NTD coordinator, Pastor Veronica Mark, taking us through the situation analysis of NTD within the state. We also had presentation from the Director of Public Health, just taking us what is the way forward in terms of domestic financing for NTDs. Then we also had presentation from the Budget Office, taking us through the process of budgeting process.
We're looking at where money can be found and how that money can move again from state to the LGA.
We are looking up to complete elimination, but there are still cases that are to be attended to, like the advanced cases of LF, the elephantiasis, the hydrocele cases that needs operations. We can't say we have completely eliminated when these cases are still pending. So, but with this ongoing front flow meeting, we are sure to believe that after the meeting, something good is going to come out from there, because I can see all the stakeholders are putting their heads together as we plan towards a beautiful elimination of NTDs in the state.
In day two, we moved beyond the validation and we're co-creating. We've broken down into groups to now begin to workshop this solution. What do we do from here? How do we put this into granular activities that at the end begins to mobilize domestic funds for neglected tropical disease?
We are trying to see how we can generate or raise funds to carry out a holistic and comprehensive NTDs program in the state.
Secondly, that proper and effective follow-up for the release of approved and allocated funds should be done by the NTD team. There's one thing to apply, and another thing to follow up to see that what has been approved is released.
If the local government has financial autonomy, they can release funds whenever the LGA health sector come to ask for funds for NTD programs.
Haven't seen all of the solutions. What should be our plan of activities for the next 1 year?
We are looking at developing an action plan on what are the next steps for the financing for NTDs. We want to have a co-created process that we're able to work with all stakeholders, whether it's from the Ministry of Finance, from the Ministry of Health, from various ministries, just to ensure that we're able to co-create what are the next steps towards financing for NTDs.
And what will happen next after this is giving the government a blueprint on what they can do to make sure that neglected tropical diseases are not an issue for Cross River anymore.